It's my pleasure to introduce Cheryl Bartlett. Cheryl is a nurse who has worked as a hospital administrator and now directs the Bureau of Community Health and Prevention at the Department of Public Health. Her breadth of experience in the world of healthcare makes her uniquely qualified. In particular, her leadership on the state's Health Communities Initiative, which strives to address social determinants of health, demonstrates her deep knowledge and commitment to community health care. Cheryl is responsible for the Division of Violence and Injury Prevention, Division of Primary Care and Health Access, as well as the Division of Prevention and Wellness. Please welcome Cheryl Bartlett.
What a great morning this is, and what a privilege it is to be here today on behalf of the Department of Public Health and Commissioner Smith, who wasn't able to be here this morning, with so many distinguished leaders in healthcare. And this is such a significant contribution to communities and health. It's really exciting. And to put that in perspective, in Chapter 224, where we were thrilled with the Prevention and Wellness Trust Fund, it's $60 million over 4 years. So certainly this overshadows the work that we have before us at the department, and we're thrilled to be a partner in this. And first, I'd like to acknowledge the providers and CEOs of the community health centers. You truly are our frontline partners in providing public health, providing accessible, affordable, compassionate care, promoting health equity to decrease disparities with culturally and linguistically appropriate services. To partners, the Commissioner and the Department recognizes and applauds your commitment to community health through your generous support of the Partnership for Community Health. Across the Commonwealth, your funding really will support health promotion, and we really recognize your generosity not only with this grant, but also with your Mass in Motion support. To Neighborhood Health Plan, your contribution to this partnership is yet another example of exemplary leadership that should be a model for other providers and payers to support community and clinical linkages, bringing resources where individuals live, work, and play. And the Department of Public Health continues to strengthen its relationship with the Mass League of Community Health Centers, as well as with all the community health centers across the state. We have a wide array of programs that we fund and we work together on to improve patients' health. We have family planning and teen pregnancy programs that reduce unplanned pregnancies and improve reproductive health. We have HIV and AIDS programs and work closely with community health centers on testing and early detection and treatment. And we are the best state in the country for the reduction in HIV. We have tobacco cessation programs, again, one of the leading states in the nation for reducing exposure to tobacco and chronic diseases that are associated with the use of tobacco. We have substance abuse services. We have methadone programs with many community health centers. We have our Narcan program that reduces overdoses, and we've had significant successes in that. We have oral health services that promote screening, that promote fluoride applications in our sealants to reduce one of the most common chronic diseases in the Commonwealth. And we have a new initiative, the Integrated Approach to Chronic Disease, and our first statewide partnership for chronic disease and health promotion. Instead of looking at diseases categorically and siloed, we're really looking at the person holistically and how do we improve lifestyles and risk factors so that we prevent chronic diseases and reduce the impacts of them. We have immunization programs with many of our community health centers. We have a women's health network that is a screening program for breast and cervical cancer so that we can have early detection and get people treated before they're so ill. We have health professional shortage area designations that we work on to identify places in Massachusetts where we can provide loan repayment to incentivize folks to practice in places where often there's limited access to primary care. We have support of the patient-centered medical home, and we have work on the community health worker, and recently created a board of certification so that we can credential community health workers so they can really become an important part of our workforce. And we have our campaign Mass in Motion that has evolved into the community transformation, where we're in 52 communities, reaching 33% of the population, promoting reduction in use of tobacco, addressing cardiovascular disease through better blood pressure and cholesterol control, and to increase healthy eating and active living so that we can reduce obesity and the associated chronic diseases with that. So we're really excited today about the support of partners in Neighborhood Health Plan to work with the Mass League and the community health centers to really further the improvement of the public's health. Thank you very much and congratulations.